The next two, still from our friends in Florida here. When will the Quality Assurance Handbook Volume 2 be updated for lead? Do we have a date on that, or do we want to get back to them with some information?
Mike Papp of our QA staff has recently updated the QA handbook. Know that he's done a lot of work, which is in the rule itself for quality assurance. We probably should get back to the questioners about the exact deadline and timeline. But clearly the rule itself, as well as the implementation, for instance, the performance evaluation plan for lead, are things that we have to work on very quickly over about the next 6 months.
All right. And for our caller from Florida, we will get back to you with information on the Quality Assurance Handbook, as well as AQS report being able to calculate completeness. The next question we have comes in from Colorado, and again for Lou, so you're on the hot seat here today. If EPA uses 2005 to 2007 lead data to determine attainment for the new lead NAAQS, Denver may be out of attainment. However, the high lead concentrations during 2005 occurred due to cleanup activities at a Superfund site that was mitigated and closed in August 2006. Although most lead sites in Denver were closed in December 2006, the lead data since that time is well below the new NAAQS at a max quarterly average of 0.02 micrograms per cubic meter. Denver currently has one lead monitoring site. Are areas like Denver likely to be classified as non-attainment, or could this area use 2006 to 2008 data to show attainment? And Larry, you may want to jump in here as well. I think boiling this down, are we going to use 2005 to 2007 data, or will some areas be able to use data from 2006 to 2008 to determine attainment?
Well, maybe I should go first.
Go ahead,
okay.
As I mentioned before, we're going to be doing a two-tiered approach in terms of doing designations, and the Clean Air Act provides for EPA to actually designate areas within 2 years of the NAAQS being promulgated. Or if EPA has insufficient information to do the designations, then we can take an additional year, which would be 3. In this particular case, we'll be designating some areas under the new current monitoring network where the data is appropriate and where we are seeing violations of the standard. In the cases where the data from the current monitoring network are not appropriate to do designations, we'll be taking that additional year to do the designations within a 3-year period. So in the case of areas where the data was not appropriate, we're going to be doing the designations based upon the data for the new monitoring network that will be in place in 2010, I believe. And so we'll be doing designations for those areas in 2011.
And that would be based on data from which 3 years?
The three, basically, in the case of areas where we won't be designating those areas within the first 2 years, the data that we'll be using will come from the new monitoring network that will be put in operation within the next 2 years or so. And so areas that will be designated as non-attainment, we'll use at least that first year data that's going to be provided under that particular monitoring network to do designations.
Okay, so it sounds like for very specific questions like this, it might be helpful to touch base with your regional office to have discussions about the specific 3 years of data to be used. And we'll certainly forward that question on to them as well.
And let me add, Allison, that we always try to use, where appropriate, more recent quality assured data versus older data sets. And as we've done, for instance, for PM 2.5, for an existing monitoring site, if a state had, for instance, 06 through 08 data, and fairly early in 2009 went through perhaps an expedited certification period to where they could go to the region and then show to us that the data are QA'd and complete. If that was within our timeline and the 05 data showing the violations fell off, so to speak, I think that would still be an option. We've done it for other pollutants, and if there was certainly compelling information why the earlier year of data was no longer appropriate, I think we would take that under advisement.
We would, and a lot of that goes back to the communication that will take place between the state and the regional office and headquarters. States will be given an ample opportunity to provide additional information if it's appropriate, and as Lou just mentioned, where it's appropriate, we will take in consideration any data that the state wants to submit.
Okay. Denver, I hope this was helpful for you, and we would encourage everyone to get in touch with their regional offices early on as you begin developing your plans and providing your monitoring data. Lou, back to you again. Let's talk about PM10 high-vol samplers. And this question comes to us from Sarasota County, Florida, and the question simply is, if we have a PM10 high-vol sampler in surplus, can we retrofit it for lead sampling?
No. PM10 high volume, the high volume method, is not one of the approved methods for our new FRM. It's based exclusively on low volume PM10 for a number of reasons that many experienced monitoring people understand and the states do. Better precision, better cut of PM10, low volume versus high volume. So although we realize that there is a large inventory of high volume PM10 monitors out there, except for providing some context and background information, they will not be approvable as either FRM or FEMs in the future. It will be exclusively a PM10 low vol method.
Okay. Let's turn now to emissions inventories. What emission inventory year should be used to determine sources emitting more than 1 ton a year? This question comes to us from Hawaii.
We are in the process, of course, of updating the 2005 NEI. In most cases, states should use, of course, the most appropriate emissions estimate. We would hope that would be the most recent NEI, or in fact any other database that can be technically justifiable and defensible. I think for most states it will be the 2005 data, but we would encourage all states to work with their regional emissions contacts if there's some reason to believe that either 2002 or even the 2005 NEI is not as appropriate or representative, particularly for these smaller sources under 5 tons, where this requirement to go lower is relatively new. There's certainly an opportunity over the next few months to work with the regions as well as the OAQPS emissions contacts and make sure that's what is in the 2005 NEI, for instance, is what the state feels is the most representative for that particular source. So presumptively, we'll say 2005. But I don't want to shut off the opportunity for states to go back and dialogue one more time and make sure that what information is in there, or to work with their sources, for instance, and do updated stack tests and actually update these emission factors. These are all opportunities that I encourage states to look at very closely over the next 2, 3, 4 months.
Okay. The next question comes in actually not from a state or local agency, but from Met1 Instruments. And the question is, does the agency see a role for a new technology such as a continuous ambient lead monitor, either TSP or PM10, under the new standards?
Absolutely. In fact, when we revised the federal equivalent method procedures in Part 53, we specifically left open the ability of different kinds of technology to be approvable as an FEM. We're certainly aware that a number of vendors are looking at continuous technologies as the cost comes down to where they're more field deployable in large numbers. As we've done for PM 2.5 as well as for PM10, we're very interested in that technology. We don't know that that is going to be a short-term option for most states. I think they're going to have to rely on either high-volume TSP or low-volume PM10 filter-based methods, but we have left open the door to where continuous methods could be potentially approvable as FEMs, and we hope sometime in the future, perhaps even the next review of the lead NACs, that we'll actually see technology that can be tested in the field and evaluated to see if it passes our criteria.
Okay. All right, let's let Lou catch his breath for a minute and send your questions in. You can fax them to area code 919-715-3569 or email them to open@doa.nc.gov. Lou, let's go talk about technologies again. This question comes to us from the University of Iowa, and it is, will a generic allowance for technologies that meet the MDL requirements of the new standard be enacted, or will anyone using an instrument different from that specified in the current FEMs be required to submit an FEM request or data package for their individual analytical instrument?
we are quite strict in how states use either federal reference or federal equivalent methods. We have a history of having multiple lead FEMs, particularly for TSP, that in fact are state-specific. This arose from procedures from the 1970s and 1980s. We're definitely not looking at going down that road again. We would expect a dialogue between laboratories and monitoring agencies with Office of Research and Development. You know, the ideal scenario would be to follow the letter of the approved FEMs, for instance, for TSP that we already have. If there are situations because technology or instrumentation has changed and a state feels compelled to propose to modify this kind of method, then we have what's called a user modification. The user modification dialogue occurs between typically a state and Office of Research and Development, and they have a period of time to review and potentially approve that. That could create a lot of paperwork and work for states across the country that might be better used in another way. So I would, I guess, initially discourage freelancing of methods and getting user modifications and encourage more to see the existing 21 lead FEMs that we have into whether or not the technology a state has or could acquire or perhaps modify their own techniques would meet those approved FEMs, because we need to invest in new lead, PM10, continuous technologies. If we spend a lot of time trying to nuance existing technologies where we have flexibility, you know, I'm asserting that perhaps that's not the best way for all of us to use our collective resources.
Okay, thank you. Larry, a question for you. Does transportation conformity apply to lead non-attainment areas?
The short answer is no, it does not. And the reason for that is that when the lead NAAQS was actually promulgated, the old lead NAAQS was promulgated back in 1978, lead in gasoline was a big issue. Since then, we've had lead taken out of gasoline for in regular vehicles. And so transportation conformity does not apply as much to lead.
Okay, thank you very much. Lou, we're back to you. This question in by email, again, about high-vol samplers, and I think we've touched on this, but let's do it again anyway. It says, we run high-volume PM10 lead monitors as part of the National Air Toxics Trend Sites, the NAT sites. Can data from these monitors be used to meet the new lead monitoring requirements?
Right, Elsa, we did talk about it in the context of having historical data, perhaps to demonstrate that PM10 is appropriate, or perhaps even to back up a waiver request for monitoring high-volume PM10 data, particularly recent data over the last 3 years, may be of value. But again, the actual FRM and potentially approved FEMs will be based on the low-volume method. And actually for the NATs, I'm quite sure that both low-volume PM10 and high-volume PM10 are appropriate methods for the air toxic site. So a state, for instance, that feels that they have an appropriate monitor for NATs could switch their high-volume monitor to low-volume monitor, and if it was in the correct location, not only satisfy their NATs requirements, but also the lead NAAQS monitoring.
Okay, thank you very much. We only have a few questions left, but we do have some time, so feel free to send in a few late questions. Again, the email address is open@doa.nc.gov. Lou, this question comes in from Utah. Will EPA develop a contract with a national lab for analysis of lead filters that states will be able to use?
Right now, we're encouraging states to partner together with their regional associations, for instance, with the national clean air agencies, to see what lead capacity for laboratories is already out there. We certainly know that there are many states that have done historically lead monitoring and may in fact have more capacity to do analysis. We also know that some states have completely divested of lead and perhaps never had lead monitoring. We feel for efficiency reasons that these regional organizations can be talking to each other, and in fact we're going to be working with the National Association of Clean Air Agencies to have them help us assess lead capacity out there for laboratory monitoring. And I think our philosophy at this point is for states to look within, to look to their neighbors, to look to their regions for capacity, because it's frankly so difficult at the national level to do a national contract. It could take so long, and there's existing and perhaps underutilized capacity right now in these states that we feel like that is probably a more cost-effective and efficient way to go.
Okay, thank you very much. And the last two questions, this one from Florida, about airports. Airports are mentioned as one of the sources of lead to be monitored. Will EPA provide guidance on modeling the emissions since there's not a stack, per se, at an airport?
We have on our work group a representative from OTAC, the Office of Transportation and Air Quality. Her specialty is monitoring airports, airport emissions, fuel factors, and the lead content. We'll certainly be tapping OTAC to help us. We're aware that airports, particularly the municipal airports, can be sources of lead. I think our latest thinking on emission factors and impacts are that they're not as great as many of the traditional sources we think of, as well as re-entrained dust from within cities. But if states are interested in looking at their municipal airports, then we'll help them to the extent that we can. And perhaps they may also have their own modelers within the state that could help them assess this more kind of non-traditional source.
Okay. We just got a question in from Pennsylvania, and let's go back and clarify high-vol, low-vol TSP samplers. This question said, we just heard Lou say that a low-vol TSP sampler is not acceptable under any circumstance. Is that correct?
Well, let me clarify that if I said that a low-volume PM10 sampler is the correct method to use. If I said low-vol TSP, in fact, there is no approved low-vol TSP for any application. So again, kind of setting back here, low-volume PM10 is appropriate options for lead and PM10. High-volume PM10 is not.
Okay.
Low-volume TSP, which we actually haven't teed up yet, is a long-term goal. We all know that the high-vol sampler is many, many decades old. We've established that, and there are certain shortcomings in terms of it being sensitive to wind speed and direction. We're working with our Office in Research and Development to think through what would be required to wind tunnel test and approve a low-volume TSP sampler. It's not as simple as it sounds, and we're thinking really long-term that we would like to have that for the next review of the NAAQS in 5 years. That's our goal. So low-volume TSP is not on the table now. Low-volume PM10 clearly is an approvable option.
Thank you for clarifying that. And our last question, again to you, Lou, is what should my state be doing now to prepare for the new lead monitoring requirements? And is EPA going to be providing supporting materials?
There are many things that we should be doing now. States in particular need to be assessing their sources, both of 1 ton and greater, and perhaps some of those other sources that they may feel could potentially violate the NAAQS, working with their emission inventory people, working with their modelers, as we've talked about, surveying their existing lead network. Where do we have existing sites that may be in the appropriate locations? Where do we have existing sites that perhaps we could relocate, which would be far more cost-effective than starting new monitors to meet some of these new requirements? We've touched about the capacity for lead laboratories. States need to be looking at their monitors, their QA techniques, whether or not they can do lab analysis or not. These are things, again, that they can be working on over the next couple of months. I think the key thing is focusing in on the near source, doing the modeling, dialoguing with those people in the agency perhaps they're not used to talking to. Find your modeler, find your emissions people, work with the region and us to determine if you want to model, if you want to monitor, or perhaps request a waiver. These are the things I would say over the next 3 to 6 months we should be working on. And again, OAQPS is shooting to a fairly early January timeline for getting some preliminary information out. It will be faster in terms of getting it out than being as complete as possible. We know that states need to get the information really quickly, so as opposed to agonizing over every detail, we want to get it out and start the dialogue so states can come back from their holidays and expect to see that very soon.
All right, terrific. Let me ask our other two panelists if they have anything they would like to add. Larry, let's start with you.
Well, in addition to what Lou just said, I think that states should keep in mind that there's a very short time period in terms of getting your recommendations in for your non-attainment areas. And so in addition to doing the monitoring information, providing that, you should open a dialogue with your regional offices to get any questions that you may have answered, and just to make sure that you're not missing anything and that you can get the recommendation in time.
Okay. Deirdre Murphy, remind us of why we're doing all this work, what these new standards are going to do to protect public health.
Well, they're going to protect children, particularly. The sensitive subpopulation that we identified for this standard is children, and particularly children living near sources. And we feel that this new revised standard will reduce the levels of lead in the blood of those children, which is an important thing to do given the health effects associated with lead.
Thank you very much. I'd like to thank all of our panelists for joining us today, Dr. Deirdre Murphy, Lou Weinstock, and Dr. Larry Wallace. And thank you all for your questions and for tuning in. If you want additional information on the new lead standards, please visit our website at www.epa.gov/air/lead. And for information on future broadcasts, you can go to www.epa.gov/APTI. Thanks again for joining us. I'm Allison Davis.